Hi, everyone. Good to see everyone here. My name is Sonia Kaurav, and today I'll be talking a little bit about the role of genetics in breast and ovarian cancer. So let's get started here. Okay, so what I like to do is generally just give a little bit of a background on what are genes. So we can start with the basics. So genes are like little instruction books that tell our bodies what to do, how to grow, heal, and function properly. We inherit these genes from our parents. So half come from mom and half come from dad. So we carry kind of like a mixed bag of instructions from both sides of our family. So now, just like a cookbook or a recipe, if there's a mistake or a typo in a gene, it might not work the way it's supposed to. So if we think about it in terms of a recipe, if the recipe says add 1 cup of sugar, but then there's a typo and sugar changes to salt, the whole the end product turns out wrong. So just like that's just like what can happen in our DNA. So if there's a small mistake, which we call a mutation in a gene, it can completely change the outcome and disrupt the body's normal function and increase our risk for certain diseases such as cancer. The good news is today we have tools like genetic testing that can help us find these changes early, and potentially we can do something about them. Okay, so how genetics contributes to cancer. So most breast and ovarian cancers are not inherited. A small portion of them are, and they're inherited by genetic mutations. So in this chart here, I have kind of different categories that you can see. There's sporadic cancers, which means cancers that happen just by chance, and that's in most cases that's what we see. There is a category called familial cancer, and this is kind of the in-between group, meaning there are more cancers in the family than we might expect just by chance, but we haven't found a certain gene mutated that's related to this. And then there is the hereditary cancer, which is caused by a pathogenic variant or a mutated gene in our bodies, and they're passed down from parent to child. As you can see, it's just a small percentage, about 5 to 10% of cancers here. So the genes involved. So these inherited cancers are often linked to genes which you may have heard of called BRCA1 and 2. And there are other cancer-related genes as well, but about 20 to 25% of inherited breast cancers are due to BRCA1 and 2 mutations. Okay, so let's talk about two of the important, all of the genes are important, but let's talk about two of the genes that you may have heard of, BRCA1 and 2. So everybody has these genes. Their function is they're like DNA repair workers. If there's a break or an error in DNA, they go back and fix that error in our cells, which prevents a lot of things from happening, one thing being cancer. However, if we inherit a mutation in BRCA1 or 2, those kind of the repair workers are not doing their job properly. And over time, that damage can build up and increase our risk for certain cancers. So what this chart shows is, excuse me. So for someone with a BRCA mutation, and this one shows particularly BRCA1, the lifetime risk of breast cancer can be much higher than the average risk. So about 60% for BRCA1, whereas for an average woman, it's about 12.5%. And also with ovarian cancer, it can be up to the 40 to 60% range, where in an average risk for a woman would be as low as 1 to 2%, I should say. So these mutations can also increase the risk for other cancers, such as prostate cancers, pancreatic cancers, and even male breast cancer as well. Knowing you carry one of these mutations can help you take action sooner through screening, preventative options, and even family planning now. This chart is another one I just like to add in with BRCA1 that shows your someone with a person with BRCA1's increased risk for pancreatic cancer and prostate cancer as well. These are often cancers we don't think about or associate with when we think about BRCA mutations. Another thing to note that is that BRCA1 and 2 are the most well-known genes, but like I mentioned, there are other genes that I mentioned here that can also increase cancer risk. Genes like ATM, CHEK2, TP53, they're important to know about because mutations in these genes can also raise the likelihood of developing certain cancers. The images I have here, they are just saying that, so the first one is showing that multiple genes can be associated with a single type of cancer. So if someone has breast cancer, there could be a change in any one of these genes listed, and there are more now too. And there's more research being done, and more could be linked in the future. The second image I have here is showing that multiple cancers can be associated with just one single gene. So if there's a mutation in just one single gene, and here they're giving the example of a gene called TP53, it can cause increased susceptibility to multiple different cancers as listed here. So understanding the variety of genes involves providing a more complete picture of inherited cancer risk and guided personalized screening and prevention strategies. Okay, so a little bit about what is genetic testing. So genetic testing looks for these changes or mutations in our DNA. It can help identify the risk for cancers, like I have breast and ovarian listed here, but other cancers as well. And how it's done is it's ordered by a doctor, genetic counselor, or other healthcare providers can also order these genetic tests. And it's done by a simple using either a blood test, a saliva test, and for children, I've even seen like a buccal swab, so just a swab of the inside of the cheek. So pretty easy to do the genetic testing. And then there are multiple types of tests that can be done. So once they have the sample from you, they can, once you speak to your either genetic counselor or doctor, they can review the type of testing or the things they're looking for, I should say. So there are single gene testing. So in this scenario, they're looking at one specific gene or looking for changes in one specific gene. And oftentimes this happens when there is a known mutation in a gene that's in the family. There's another option, which is called multi-gene panel testing. And this kind of throws a bigger net out there. So these particular genes, such as like BRCA1 and 2, are usually included in the hereditary cancer big panel test, but there are multiple other genes included in these tests too. So you can find I would say it's a little bit more common today to kind of throw a bigger cast like a wider net out there to see if there are changes in multiple genes rather than just looking at one. Okay, so what are the benefits of genetic testing? So there are several key benefits that genetic testing offers. First, it allows for early detection. So things like if there's a known mutation in a gene, things like the type and frequency of screenings, like breast MRIs, can change. Again, the frequency can change, and this can help catch cancers early. Second, it opens up options for risk reducing things such as medications that can be given to lower cancer risk, or even preventative surgeries like mastectomies and oophorectomies. And these are things that your provider will discuss to see if this is a good option for you. And they look at the whole picture. As genetic test is one aspect of it that can help guide your healthcare team. Also, again, it helps guide treatments. So there are specific treatments that can be guided by knowing what's going on with your genetics. So targeted therapies like PARP inhibitors for BRCA-related cancers is one way. So if you have like a change in BRCA1 or BRCA2, your cancer cells are already impaired at fixing the DNA. And what PARP drugs do are block the backup repair system, so the cancer cells die. So it essentially what it does is it makes treatments more effective. So knowing your risk means knowing your options, and that's really the biggest benefit of getting genetic testing done. Excuse me. So when someone has a genetic mutation in any gene, it means that there's a 50-50 chance. I shouldn't say in any gene, in the hereditary cancer genes, there's a 50-50 chance that each of their biological relatives, like their children, siblings, or parents, might also have this mutation. So because your genes are shared, your results can offer valuable information for your family, even if they've never had cancer before. So this could mean helping them understand their potential cancer risk, allowing earlier screening and prevention, and what it can look like is like a sister who knows her sibling has a change in a gene might decide to start screening earlier, or a daughter of someone who has a genetic change might decide to speak to a genetic counselor and make plans for her future. So it's a family. It can be a tough conversation, but it's a good family conversation that you can have. One test result can provide answers and guidance for multiple people in the family for multiple generations down the line. Okay, so there are some genetic testing is, I'd say new, but it's an upcoming thing. There's a lot of changes, but there are a lot of myths and concerns surrounding genetic testing. So I just wanted to address a couple of them that I hear about often. So one thing is that I have heard is that people think that only women get BRCA mutations just because it's associated with breast cancer. But men can carry and pass them on too. Men with BRCA mutations also have an increased risk for cancers like breast, prostate, and pancreatic cancer. And then myth two. So myth two is I need a big family history to have a mutation. You don't need a large or obvious family history. Some families are smaller, there's adoption in the family, or there's missing information and missing pieces that can hide a genetic risk. So testing may and it can still be important in these scenarios. And then another myth here is genetic testing will hurt my insurance. This is another one I hear about pretty often, but there is a law in place that protects against discrimination from health insurance and employment. So your results are safe in that context. Let me talk a little bit more about this law here. Okay, so this law is called GINA, or Genetic Information Non-Discrimination Act. It is a law that was passed in 2008 that protects people from discrimination on their genetic information. So under GINA, health insurance companies can't deny coverage or raise premiums because of your genetic test results. Employers can't discriminate because of results, and this applies to genetic tests, family history, or if you decide to participate in any sort of research surrounding genetics. However, it's important to note this law does have limitations. It doesn't protect against life insurance, long-term care insurance, and disability insurance. So these are 3 things to keep in mind. And I've often spoken to people who they work with their healthcare provider, obviously, to make the right decision, but they choose their testing to be at a specific time that, like, for example, they'll put into place their life insurance policy before doing genetic testing, and then they get genetic testing done. And so in that case, they're protected in a way. This law is really important because it encourages people to get genetic testing without fear of discrimination. And again, helping them make informed decisions about their health and treatment without that fear. Okay, so who's a good candidate for genetic testing? So this is a text-heavy slide, but I just quickly want to just go over some points here. So guidelines for genetic testing in regards to breast cancer have actually pretty recently been updated. So now anyone diagnosed at age 65 or younger are encouraged, or their providers are encouraged to offer them a BRCA1 or 2 genetic test. Also, if someone is diagnosed after 65 years old, if there are these reasons listed here, such as triple negative breast cancer, male breast cancer, strong family history, or results that can affect treatment, they're also a good candidate for genetic testing. For ovarian cancer, just because it is a little bit more of a rare cancer, genetic testing is recommended at any age and for any ovarian cancer. There are some other risk factors, such as some ethnicities, such as Ashkenazi Jewish ancestry, where there are more, there's an increased risk for having a change in the BRCA genes here. So those who fall under that category are often encouraged to get genetic testing. There's a family history risk as well. So if there's close relatives of breast or ovarian cancer, also pancreatic and prostate, multiple cancers on the same side of the family is something that kind of raises red flags and questions in regards to, should I get genetic testing? Or of course, if there's a known mutation in the family as well. And I just put quickly like a strong, what genetic counselors think of as a strong family history. And again, that's multiple relatives, early age diagnosis, multiple generations, and rare cancers as well. So some of the final takeaways. So I guess the key message here is knowing your genetic risk is very empowering. Having this information allows you to make informed decisions about prevention strategies and treatment options, and also family planning as well. It's important to ask questions and advocate for yourself when discussing your health. And if you have questions, don't be afraid to speak up and seek the information that you need. Ultimately, knowledge is power, and it helps you take control of your health and your future. And that's what genetic testing is aiming to help with as well. So on the next couple of slides, I have some resources and support for genetic counseling and testing in our area. If you are interested in finding out more about these resources, you can feel free to email me, and I think we can add my email in the chat there, and I would be happy to send this over to you. So we have quite a few centers in our area that have genetics programs. Let's see here. And these are also some support groups that are online. So if you want to get some more information, look a little bit more into it. Force, Bright Pink, and Share are great organizations that have a ton of information on their sites. And I've also listed a few more down there that again, if you would like access to this information, you can just feel free to email us, call our helpline, and we can get that over to you. All right. Well, thank you so much. I appreciate everybody listening in. Please let me know if you have any questions. I'll be happy to answer them. And if things come up later, I'll be happy to answer them later on too, either via email or a phone call.